Hello, AP Psychology students. Um, Yesterday, you should have watched the clips from the movie Awakenings. And as I said in yesterday's screencast, this is a movie that I recommend. It is a really, really good movie. It also is kind of sad, but it does show the real life story of people who had a problem with our topic of the next few days, and that is neurotransmitters. So neurotransmitters make the world go round. In terms of humanity, everything that we do depends on the action of neurotransmitters. These are the chemical messengers of our nervous system. They tell us what to do. They direct our muscles. They direct our thoughts. They direct our actions, along with our brain and other chemicals in our body like hormones. But neurotransmitters are so important to understand for this unit. There are two basic types of neurotransmitters. One type is called the excitatory neurotransmitter. This increases the likelihood of an action potential, which you watched about in yesterday's video. The second are inhibitory neurotransmitters. These decrease the likelihood of an action potential. Now I'm going to try to explain something here. So when the number of excitatory neurotransmitters is greater than the number of inhibitory neurotransmitters at a critical level, then the action potential occurs. And as you know, that's when the neuron fires, it sends the electrical signal down the length of the axon, and then it stimulates the synaptic vesicles to move towards the presynaptic membrane. With this video, I'm going to suggest that you definitely listen, you definitely pause, you definitely take notes, and you definitely add things that are not on the PowerPoint. This PowerPoint presentation alone is not sufficient to get the information that I'm going to be talking about in this couple of different screencasts that I'm going to make. Okay, so what's important to know is that when we have a chemical, food, water, a medication, a drug like cocaine or heroin or meth or marijuana, they are going to initiate some kind of action at the level of the neurotransmitter. So I had coffee this morning. As it turns out, coffee is what's called an agonist. It's going to mimic or intensify the action of a neurotransmitter. And I will tell you what that is in just a minute. And we'll talk about the way some agonists work, and sometimes they work, this picture doesn't have the reuptake channel on it, but sometimes they work by blocking the reuptake channel. Sometimes they work in other ways. So they make the receptor molecules more sensitive to the chemical. So my coffee was an agonist today. Antagonists are going to oppose or block the action of a neurotransmitter. So whatever that antagonist is, it's going to try to block too much of that neurotransmitter from getting through your system. So, for example, if someone takes a beta blocker blocks adrenaline, and it's going to sit on the receptor molecule, and it's going to keep the adrenaline, which acts as both a hormone and a neurotransmitter, by the way, or norepinephrine. It's going to sit on those receptor molecules and block them from coming coming through your system. So that's an antagonist. I will explain these as we go through the unit. Now, this first one I'm going to look at is acetylcholine. And I love talking about this one in class because I say, hey, has anyone seen one of these in real life? Black widow spider. Or how about this one, the poison dart frog? Has anyone heard of botulism before? Surprising to me how many people have not heard of botulism. All right, so what does acetylcholine do? Acetylcholine is in every single muscle. It enables every muscle action, voluntary and involuntary. So think about those Awakenings patients. Was their acetylcholine working? Were they digesting food? Were they swallowing? Well, you didn't see it in the part that you saw. But yeah, they were breathing, their hearts were beating, their food was digesting. So their acetylcholine was not the problem. All right, so I'd like you to think about acetylcholine also as being important for learning and for memory. So there's a part of the brain that we're going to talk about later called the hippocampus, and that part of the brain also has a large number of acetylcholine receptors in it. So every muscle action, voluntary and involuntary, and important for learning and memory. So think for a second, what is a disease or a disorder that involves the loss of the ability to learn new information and the loss of memories? And that disease is Alzheimer's. Alzheimer's is something that my dad suffered from. And many of you likely know someone who has had Alzheimer's or who has it now. It is a heartbreaking illness as you lose the person that you love piece by piece, as their memory gradually fades and as they are unable to remember even who you are. But just speaking from someone who has known many people, four of my aunts and uncles with Alzheimer's and my dad, the core of their being is still there. And I just want to encourage you to think about it that way. But we do know that in that part of the brain, the hippocampus, which is like a little C-shaped structure, that part of the brain starts to look empty on MRI scans. That's because those ACH neurons are being lost. Now, an agonist for acetylcholine is this right there, a black widow spider venom. So I'd like you to think about what an agonist would do. So it enables every muscle action, voluntary and involuntary. An agonist potentially is going to cause convulsions or even cardiac arrest. And what cardiac arrest is, normally your heart pumps, 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 pumps. But if you have too much of an agonist for acetylcholine, like caffeine is an agonist for acetylcholine. So my coffee was an agonist for acetylcholine. But let's say you have one of those power drinks, okay? What's going to happen potentially, and this has happened, I've seen this on the news, is that you're going to go into cardiac arrest and your heart will start to fibrillate. And that's when it needs a shock. It can be shocked back into a normal rhythm. But if you have way too much of an agonist, if you get bit by a black spider widow, go to the hospital. You need emergency treatment. But you might also have a milder agonist, like I did today, coffee, or like nicotine. That is an agonist for acetylcholine as well. Now think about the opposite if you have an antagonist for acetylcholine. So from this frog right here, the poison dart frog, you've all seen it in movies. Someone, they wipe the dart against the skin of the poison dart frog, and then in a movie they blow through a dart, and the dart, of course, lands like right in the neck, and then the person goes boom. Okay, so what's happened is that particular chemical called curare, which is something you do need to know, is actually an antagonist for acetylcholine, and it basically paralyzes the individual, including their heart and their lungs. Okay. Botox is actually an antagonist for acetylcholine. So if you know someone that has gotten Botox injections, for example, here so that they don't squint, what happens is it's actually sitting in the receptor sites for acetylcholine. And you know what happens when you have Botox? You have to keep having Botox because those muscles will atrophy. And if you don't continue having the Botox, then you'll start to get droopy eyelids. So I have some friends that got Botox there, and they didn't know about the long-term effects that they would have to keep doing it, or their eyelids will start to droop. So, I'd really just take that decision very carefully. Another thing is botulism. Botulism is a particularly poisonous type of food infection that acts as an antagonist for acetylcholine. The symptoms are listed on the slide here. And what happens is the person might even seem like intoxicated, like they're talking kind of funny. They can't swallow. Their mouth is dry. Their eyes are droopy. Their speech is slurred. If you suspect that you or someone else has botulism poisoning, again, you need to get to a doctor. It can be treated, but it is very serious. It is not so common now because we have higher food safety standards than in the past. But when I was growing up, if you saw a can with like a bubbled lid, then you might suspect botulism and you wouldn't want to eat from that can. And I would still suggest that is true. So acetylcholine, super, super important neurotransmitter. I think I've made my point about that. But the other one that's super, super important is dopamine. Now, dopamine is abbreviated DA, and it enables every voluntary movement. So think back to those Awakenings patients. They couldn't move their voluntary muscles, and if they did, it was very, very slow. So the fact that you're moving your hands or your head or any part of your body right now is thanks to both acetylcholine and dopamine. Dopamine also gives us pleasurable emotions. When you look at your electronics, I've said this to some of my classes already. Well, it's believed we get a little bit of a dopamine kiss. We get a little bit of dopamine. And what dopamine does is it acts as like an internal reward system so that we keep eating, we keep drinking water, staying hydrated, and we keep reproducing because after all, the survival of the species depends on it. It is our brain's natural reward system. There is a part of the brain that we'll talk about later on that gives us rewards, and this reward is in the form of dopamine that makes you feel good. So some of you may know someone with Parkinson's disease. This is a disease, if you know someone with it, you'll know exactly what it does. It is caused by a deficiency of dopamine neurons. So the person who has Parkinson's disease has muscle rigidity. They have tremors sometimes with their hands. They might be a slow tremor. They might be a fast tremor. Their speech is impacted because they can't move their tongue or their mouth the way that they normally would. They have what we call flat affect. That means their facial expressions are flat. And you know what's kind of sad about this is in Parkinson's, because they don't have the dopamine that we normally would have, they have a difficult time feeling pleasurable emotions. I really, really feel bad for people with Parkinson's disease. There are some treatments out there, and some are cutting edge treatments that hopefully will make Parkinson's disease a thing of the past. But if you would think about it already, what would you need to treat this? A dopamine agonist, something to increase the dopamine, or a dopamine antagonist? And if you think about it, you would need a dopamine agonist. You would want to increase the amount of dopamine. Schizophrenia. This picture here is a illustration done by someone that I know of who has schizophrenia. And it is kind of a shocking picture, but it illustrates some of the changes that occur during schizophrenia. So schizophrenia is caused by elevated dopamine. Now, we don't know exactly the underlying causes of this. We know that it develops in young adulthood, sometime between the ages of 18 and 30, depending on if you're male or female. We think there might be some genetic roots to it. There might be something that has to do with the prenatal environment. And we'll talk about schizophrenia at a later time. But this increases, or rather, this disease is noted by the number of dopamine receptors 6 times what someone would normally have. And we believe it's because of this that an individual has hallucinations or delusions that come with schizophrenia. So delusions are like believing that something is there that's not there. Oftentimes it's paranoia. And hallucination is actually like seeing something that's not there. So agonists for dopamine, one is called L-DOPA. This is a synthetic dopamine that is a treatment for Parkinson's disease. And then nearly all drugs of abuse, especially cocaine and marijuana, are dopamine agonists. So what's going to happen when you take a dopamine agonist? Again, I want you to think about this. If you have Parkinson's and you're getting too much L-DOPA, then what might you start acting like? Think about that for a second. You might start acting like somebody who has schizophrenia. So, cocaine in particular is a very addictive, dangerous dopamine agonist, and it will provide pleasurable emotions for a while, but then it starts to destroy the receptor molecules for dopamine, and so then you need more and more and more to get the same high. An antagonist for dopamine are any of the antipsychotic drugs. This is a whole classification of drugs that blocks the receptor sites for dopamine. So thorazine, chlorpromazine, they're the names of a couple of them, and they are used to treat schizophrenia. They are also used in elder care for people who are suffering from Alzheimer's. For some reason, the antipsychotics work better to help calm them down sometimes than do the anti-anxiety drugs that we'll talk about later. But antipsychotics, they have a really bad side effect. If you give someone with schizophrenia too much of an antipsychotic, well, what's going to happen to them? They're going to get muscle rigidity. They're going to get tremors. They're going to have slurred speech or flat affect. My uncle had schizophrenia, and I know that he had some of these tremors that were caused by too much antipsychotic. So when you're dealing with dopamine, I think this is one of the trickiest of the chemicals to treat when you have Parkinson's or schizophrenia, because it is such a critical chemical in both our voluntary movement and in our ability to experience pleasure, and with too much of it to get over rewarded with something like cocaine. So I hope you have really understood the basics of dopamine and acetylcholine. Very important neurotransmitters. Make sure you understand the role of agonists and antagonists for both of these chemicals. Thank you for your attention.